Hi everyone, welcome to my YouTube channel, and I will leave a link in the description. In that link will take you to my Twitch channel. Well, I will talk about language and brain tumors and how it affects your brain. First of all, let's talk about language. When we talk about language, we often refer to the spoken one and ignore the other varieties. Actually, language has many forms, such as the oral, written, the body, and even the sing language, because it is a way of expressing ideas. There can be many ways to communicate. Thanks to language, we can talk about our needs, we can make jokes, we learn, and we also look for help. There are no limits for language. Language is inherited. That is, we are born with the talent to speak. But we learn how to use language over time. As we learn, we develop complex sentences and meanings. According to the linguists, there are more than 7,000 languages in the world, and there may be thousands or millions of regional dialects as well. Language is also mistakenly attributed to humans only. We must not forget that animals also communicate with certain sounds or smells with each other. For instance, as an example, the honeybee dance. It's a good example for animal language. Bees tell their peers about a source of food or a source of danger by means of its dance, by means of its dance moves. So they communicate with dance moves. Animals and insects also communicate by means of certain behaviors or by releasing a certain smell, and those smells will make your hormones go out, something like that. But in the end, you are communicating with each other. Music and language. For many years, it was believed that the neural systems for language and music were the same. That is, the same region of the brain were dedicated to language and music. However, in the last few years, information from neuroimaging techniques demonstrated that different areas of the brain process the information for both music and language. This is best illustrated by aphasia studies. Aphasia is the loss of ability to articulate thoughts and to comprehend language. It can occur due to a stroke or brain infection, and brain tumors also can cause this, especially to the left hemisphere where most language abilities are located. Most of the time, aphasic people retain certain musical abilities. For example, a man called Maurice Ravel, who was affected by Wernicke aphasia, retained the ability to recognize melodies, tones, and rhythm in music, even though he had forgotten the names of notes and had extreme difficulty in writing. In fact, many patients with Wernicke aphasia can perceive music fairly well, whereas the majority of patients with Broca aphasia have impaired music perception. This latter finding as with the results from neuroimaging studies indicates that language and music are processed in different areas of the brain. It is somewhat ironic then that music can be used to recover speech ability in people with Broca or Brosa aphasia. Immediately next to the language region damaged in this form of aphasia exists a region specifically associated with music, and they with melodic intonation therapy, in which words are associated with musical pitch. They teach their patients to sing the words they wish to speak, then thus actually rebuilds speech production in the right hemisphere. The ability of the brain to shift speech ability to an adjacent region through the formation of neural connections based on music is an elegant example of neuroplasticity. So, how can you prevent a brain tumor? You cannot prevent a brain tumor. You can reduce your risk of developing a brain tumor by avoiding environmental hazards such as smoking and excessive exposure to radiation. You can develop a brain tumor if you had cancer, family history of cancer, genetic mutation that causes abnormal cell growth, exposure to certain chemicals, and long-term exposure to radiation from X-rays or treatment for other cancer types. What's the look for people with a brain tumor? The outcome for people with brain tumors varies greatly. Factors that can affect prognosis include the tumor type, grade, and location. Successfully removal of all of the tumor and your age and overall health. In many people, doctors can successfully treat a brain tumor. Other people live active and fulfilling lives with brain tumors that do not cause symptoms. In some people, brain tumors can recur after treatment. These people may need to continue treatments, including chemotherapy or radiation, to keep the tumor from growing or spreading. After brain tumor treatment, you should follow up with your doctor regularly. You should contact a healthcare provider about a possible brain tumor if you experience signs and symptoms of a brain tumor. If you have brain tumor, you may want to ask your doctor, is that the brain tumor malignant or benign? Benign. I don't know the thing to pronounce it. What kind of tumor do I have? You can ask as a second question. What type of treatment is best for me? And for the last question, you can ask to your doctor, will my treatment cause side effects? What are the treatments for a brain tumor? Well, before that, I think we should mm, look at the symptoms of a brain tumor. Some people with a brain or central nervous system tumor have No symptoms. In some cases, doctors discover a tumor during treatment for another issue, another problem. As a brain tumor grows and presses on surrounding nerves or blood vessels, it may cause symptoms. Signs and symptoms of a brain tumor vary depending on the tumor's location and type, size, and what the affected part of the brain controls. They can include headaches that are ongoing or severe, or that occur in the morning or go away after vomiting. Behavior or personality changes. Confusion, being confused. Difficulty with balance or coordination. Trouble at concentration. I have trouble at concentration. Nose, nausea and vomit. It is something like it is something about nose or something like that. I don't know. Numbness, weakness or tingling in one part or side of the body or face. Problems with hearing, vision or speech. Seizures, unusual sleepiness. Trouble with memory, thinking, speaking or understanding language. You may just look at your teacher and understand nothing. There may be some kind of problem in your head. What are the types of brain tumors? Doctors classify brain and central nervous system tumors based on where they form and the kind of cells they involve and pressure. Brain tumors that are usually include acoustic neuroma. These tumors occur in the vestibular nerve, the nerve that leads from the inner ear to the brain. Acoustic neurons are also called vestibular schwannoma, something like that. And another one, gangliositoma, nerve cells. These central nervous system tumors form in neurons. Another one, meningioma. These are the most common type of primary brain tumors. Meaning, meningiomas develop slowly. They form in the meninges, the layers of tissue that protect the brain and spinal cord. Spinal cord. In rare cases, a meningioma can be malignant. I don't know the exact pronunciation for those words. I am reading it from a site about brain tumors. There is that pineocytoma. These low-growing tumors form in pineal gland, which is located deep in the brain and secretes the hormone melatonin. Pituitary adenoma. These tumors form in the pituitary gland, which is located at the base of the brain. The gland makes and controls hormones in body. Adenomas are usually very small, chordoma. These slow-growing tumors typically begin at the base of the skull and the bottom or part of the spine. They are mostly not cancerous, not bad. Well, there are some others, but let's look at the treatment. Surgery When possible, surgeons remove the tumor. They work very carefully, sometimes doing surgery when you are awake, to minimize the damage to functional areas of the brain because they do it when you are awake to find out if they damage your brain. They damage your brain, they will just not do it in that way. So that's a good thing to go in that surgery when you are awake. Radiation therapy. High doses of X-rays destroy brain tumor cells or shrink the tumor. Some people have radiation before surgery to shrink a brain tumor so that the surgeon can remove less tissue. Chemotherapy. Anti-cancer drugs kill cancer cells in the brain and throughout the body. You might receive chemotherapy through an injection through an injection into a vein or take it as a pill. In some cases, doctors use chemotherapy before surgery to make the tumor smaller. Your doctor may recommend chemotherapy after surgery to kill any cancer cells left behind or to prevent remaining tumor cells from growing. Immunotherapy. Immunotherapy, also called biological therapy, it's a type of treatment that uses your body's own immune system to fight with cancer. That therapy mainly consists of stimulating the immune system to help it do its job more effectively. Targeted therapy. Drugs target specific features in uh, drugs target specific features in cancer cells without harming healthy cells. Your doctor may recommend targeted therapy if you have trouble tolerating the side effects of chemotherapy, such as the things that I can't pronounce. Well, there are laser thermal ablation, watchful waiting active surveillance, these two, and the laser thermal ablation is another kind of treatment for tumors. Well, you may forget to how to speak. You may not have any kind of cancer in your brain. You may forget to speak because you were in the home in this pandemic. That can cause that because we are not talking with anyone in our home. We are stuck in our homes. We may forget how to speak. And there are other kind of things that can cause this. You may be tired or you have no vitamins left in your body. You may be hungry. Maybe you forgot what you will speak about. But the worst thing is to have a cancer. So, as a guarantee, you can see a doctor and they may find out, they can find out, they must find out if you have cancer or not. They may just do some tests and they can find out that easily. I'm telling this cancer thing Because if you have cancer and you don't know it, and you don't see a treatment for that, it may get bigger and it can cause more things and it can even kill the patient. So be careful with your life. Always wear your mask and don't go out if it is not necessary. Take care of yourselves and subscribe to my channels. Follow my Twitch channel. It's in the description. Link in the description. And thank you for listening to my this thing. This thing. Yeah. I will put a I will upload a video of game and I will talk about this. See you next time.